Welcome to Danish-InfoNews TV, your Danish English special report. Misgendered in court. Ignored in hospitals. Hidden prejudice in plain sight. This Danish-InfoNews TV special report takes you inside three powerful developments shaping LGBTQ+ rights and health in Denmark, from a groundbreaking trial in Lyngby to new healthcare training initiatives and the research that reveals how far the country still has to go. We'll take a look at a deep personal story of a young non-binary Dane who uncovered the challenges and the hope at a pivotal moment for equality. The three current developments: a landmark misgendering court case, a new healthcare training initiative, and the groundbreaking research on hidden prejudice, alongside the personal story of a young non-binary Dane, revealed the urgent need for stronger legal protection and inclusive healthcare for LGBTQ+ people in Denmark. The misgendering trial in Lyngby. The court case began August 12, where the court in Lyngby will begin hearing on Denmark's first case involving misgendering, referring to someone in a way that contradicts someone's legal gender. It's a harassment case where Nadia Jacobsen, legally female but born male, has sued psychotherapist Lotte Ingeslev for harassment over a March 2024 blog. In the blog, Ingeslev is consistently referring to Jacobsen as a male while criticizing the Danish Football Association's new inclusion guidelines for trans, intersex, and non-binary players. According to Jacobsen, the issue is not only the misgendering, but also the blog's portrayal of her identity as a fetish and its suggestion that trans people change legal gender to spy on women in changing rooms. Ingeslev responds by insisting the case is about freedom of speech, stating, quote, "I won't live in a world where I can't say a man is a man," unquote. It will be up to the courts to determine whether deliberate misgendering can amount to defamation under Danish law, a legal precedent that experts expect could shape future cases involving gender identity. On another story, I didn't feel my body was mine, Chris's story. While the courts debate legal limits, many LGBTQ+ people in Denmark face daily mental health struggles. Chris Kvistgaard Eggerholm, 20, identifies as non-binary and uses they, them pronouns. Growing up, they faced exclusion and constant discomfort in their own body. By the age of 13, they began self-harming, cutting their arms, and later developed an eating disorder. "It was easy to harm a body that didn't feel like mine," Chris recalls. A recent study from LGBTQ+ Denmark and the Association for Eating Disorders and Self-Harm found alarming rates of self-harm and eating disorders among LGBTQ+ youth, with the number of 15 to 24-year-olds developing eating disorders doubling over the past 15 years. With the help from psychologists and helpful friends, Chris has now recovered, but warns that the problem is widespread. "I wish I could say it surprised me, but I know many who have the same struggles." A new research from Denmark reveals hidden homophobia and wins Salmon of the Year award. Recently, LGBTQ+ Denmark awarded Årets Laks Salmon of the Year to 4 researchers from Aalborg University and the Statens Serum Institute for their work in Project Sexos, the first study to map Danes' attitudes towards sexual minorities. Findings of the report: 21.7% of the Danish population believe sex between people of the same gender is morally unacceptable, far higher than many assumed. Rates are lower among younger people and women, and higher among older men, those with less education, religious minorities, and people in rural areas. One of the award winners, Professor Christian Gragort, finds the findings very surprising and disheartening. It's the first time we see it in black and white, something we as a society should take seriously. LGBTQ Denmark chairperson Morten Gromstrup praised the research for challenging the myth that homophobia is virtually gone in Denmark. We are neither there when it comes to LGBT people's well-being nor in attitudes toward them. Region of Southern Denmark acts on inclusion. In a significant policy step, the region of Southern Denmark announced on August 9 that it will provide training for healthcare staff on LGBTQ+, people's living conditions and health challenges. Their 2025 budget policy includes action plan to improve LGBTQ+ patients' experience in the healthcare system. The training aims to increase healthcare professionals' knowledge of LGBTQ+ needs, promote inclusive, respectful patient interactions, reduce health inequalities across the region. New training for elder care staff to support older LGBTQ+. A new health initiative, Danish Health Authority launched a free e-learning course aimed at preparing elder care workers to meet older LGBTQ+. Residents with openness and curiosity. Older LGBTQ+ people often face heightened vulnerability in elder care settings, not only due to aging, but because many have endured decades of prejudice. Everyone should be able to be themselves and feel safe when they move into a nursing home or receive home care, no matter who they love, says Biao Dapper Scanning, special consultant in the Unit for Elderly and Dementia. Scanning stresses the problem is often lack of knowledge, not intentional discrimination, nothing that some nursing home leaders still claim. We don't have people like that here, despite statistics showing 7 to 10% of the population are LGBT+. Jenny Stenberg, development nurse at Jægersborg Nursing Home, says, quote, "We shouldn't be shoving a rainbow flag down anyone's throat. But people shouldn't be forced back into the closet just because they've grown old," unquote. Wider health challenges for LGBTQ+ people. Mental health risks. Higher rates of depression, anxiety, loneliness, and low self-esteem. Transgender individuals face up to 8 times higher risk of suicide attempts. Increased substance use and exposure to harassment or violence. Physical health concerns. Higher occurrence of STIs in some groups. Specific medical needs related to hormone therapy. Healthcare barriers. Misgendering, microaggressions, and discriminatory assumptions. Lack of LGBTQ+ health knowledge among professionals can result to delay care due to mistrust or fear of negative experiences. Facts about LGBTQ+ health in Denmark. 21.7% of Danes hold homophobic attitudes, Project Sexus. Higher risk of suicidal attempts amongst transgender individuals. double amount of eating disorder among youth. 7 to 10% of the Danish population are LGBT+, yet they avoid contact with healthcare in fear of discrimination. A pivotal moment. As Camilla Hersom, director of the Association for Eating Disorders and Self-Harm, puts it, inclusion and understanding are the most important things. Creating a safe and confidential space is crucial. With a landmark legal case testing protection against harassment, new research exposing the persistence of prejudice, and national training programs aiming to bridge knowledge gaps in both general healthcare and elder care, Denmark stands at a turning point. True equality for LGBTQ+ people will require both legal safeguards and systemic healthcare reform to guarantee dignity, safety, and well-being for all, from youth to old age. About the special report. This report is part of Danish-InfoNews TV's ongoing coverage of health, rights, and inclusion in Denmark. We bring you verified, balanced, and deeply researched stories that matter. If you're in need of help, spiseforstyrrelser og selvskade, support for eating disorder/self-harm, please contact Livslinjen Crisis Counseling on 70 201 201. LGBT+ Denmark advice and support, go to igbt.dk. Thank you for watching. Subscribe for more updates.